तुम
Mrs. Bharti Oswald, welcome you all on behalf of Dr. A. Clinic. This is the first live patient showcasing hair restoration surgeries in Asia. Now, I introduce you Dr. Arvind Oswald, who will be explaining the different types of hair transplant procedures. Specific patient results will also be discussed. Later, you can interact with the patient. Thank you. Dr. Arvind Oswald.
Thank you. Good afternoon. Today we will be talking about hair transplants. Hair transplant, the basic thing is we take the permanent long-lived hair roots from the back of the scalp and the side of the scalp and we transplant them into the area which is losing hair. Or we can use hair from other parts of the body like the chest or even the beard hair and we can transplant them also to the top. Before we go in detail about the hair transplant, we'll first talk about certain common terms that are used. Next. A hair transplant helps in pattern hair loss. Pattern hair loss is the commonly encountered hair loss, something which you see in day-to-day life in a lot of people. It's different from hair loss due to burns or scars or injury or due to traction alopecia. Traction alopecia is when someone ties his hair too tight and wears a puckey. That is the thing when a person loses hair from the sides or top. Right? In all these different types of hair loss, we can perform hair transplant. Right? Next. Hair grows in forms of follicular units. Hair does not grow as one hair in each place. Hair grows as groupings of 1, 2, 3 or very rarely 4 hair in one place. These are called follicular unit grafts. These. Right? This is a picture of a donor area, scalp donor area, which has been, the hair has been cut to show how they are growing. Next. There are two basic methods of performing hair transplant. The basic difference between those two methods is how you are taking out the grafts. One is the strip or FUHT method. In this method, a hair-bearing strip of scalp tissue is taken out from the back and the sides of the scalp. Now the strip is then divided into individual follicular units under magnification. The disadvantage of this technique is that you will have a stitch scar in the back of your head. If you shave it, it will be noticeable. Recent advances like triclosure or trichophytic closure is a form of closing the wound when we take out the strip that tries to get hair growth in the scar. However, that does not mean that there will be no visible scar. That means there will be a scar with some amount of hair growth in it. Right? Next. To overcome this difficulty of there being a strip scar, the FUE or FUSE method is used. In this method, the hair units or follicular units are taken out one by one. Disadvantage being that it is more laborious, more time consuming, but the advantage being that it is less invasive, there is no stitch and therefore there is no stitch scar either. After performing the procedure, later on, if the patient wants to keep his hair very short, like a buzz cut, or even wants to shave, then he has that option open before him. Next. Another advantage of the fuse technique or a fuse technique is that with this method, hair roots or hair follicles can now be extracted from different parts of the body also. Because with a strip, we won't be taking strips from all over the place. That will leave too many scars. But with the fuse technique, we can take hair one by one. Body hair are extra hair. They should be seen as extra hair that can be used for transplant. We cannot just use body hair all by themselves. We have to mix them with scalp, but they augment the available donor supply. As a result, more people can go for more denser hair restoration now than what they could do earlier. This is called body hair transplant or BHT, that is body hair follicles taken out and transplanted to the scalp. When using the body hair or when performing BHT, one has to assume that the hair will retain its original characteristics even after the transplant. One should not assume that it will become like a scalp hair just because you have moved a chest hair from chest to the scalp. However, if a person has good robust hair on his chest or other parts of the body, then it can be used mixed with the scalp hair. Next. The procedure of hair transplant in general. I will talk about FUHT, body hair transplant as well as fuse. This is common for all of them. The procedure is performed under local anesthesia. The patient is awake during the procedure, but the area is numb so that he does not feel any pain. After the procedure is over, we show him where we have placed the grafts. After that, we bandage the area. The bandage has to be kept only for 1 day. It can be removed the next day morning by the patient himself. There is no need of any admission, no need of coming back again and again to the clinic. The bandage, then you can start washing your head and do normal daily activities, but no heavy exercise and no direct rubbing of the recipient area. Recipient area is where we have placed the grafts.